Since the news about the first two confirmed cases of coronavirus in St. Kitts and Nevis was reported on Wednesday, the COVID-19 task force has been sensitizing the public on what happens next to curtail the spread of the disease. On a recent episode of Policing with You, Director of Community Health Services, Dr. Keisha Liddy, explained that the other passengers on the flight with the two persons who have contracted the virus are being interviewed to determine who should be tested.
I said before, yes, we do have that collaboration between the National Security, NEMA, to help us assist in monitoring persons and making sure that they're in and making sure they have the means to stay in. But I think we need to expand this as a national approach and realize, as I said before, quarantine and isolation are two measures that are needed for control of this disease, for containment, for reducing local transmission.
She also spoke about the monitoring of persons in quarantine, noting that quarantine and isolation are needed to restrict the spread of the virus in the Federation.
We are now engaging in robust contact tracing. So, yes, individuals on the same aircraft or airline will be fully interviewed because we have to assess what contact means. If you were in the cabin and you were the pilot and a person with COVID-19 is sitting in a certain aisle, there's a buffer zone around that person where we have to now identify who are contacts, and that buffer zone speaks to at least three seats in front, behind, and two laterally, right and left. So that robust interaction and interview of possible contacts is ongoing right now, and then we will ascertain, based on that risk assessment, who should be tested, who are actual contacts, yes, no.
Dr. Liddy said that we need to be our brother's keeper at this time and look at how we can play a part in helping persons in quarantine, which is our social responsibility.